Hi everybody, my name is Skylar. I'm the Health Promotion and Marketing Coordinator here at the MLK Health Center and Pharmacy. Today we have our volunteer endocrinologist, Dr. Chico, to talk to us about diabetes.
Hi, I'm Dr. Chico and I am at Willis Knighton North, and I love the opportunity to be able to work at MLK.
Alrighty, yeah, so we're just sitting down today to talk about diabetes, some of the common questions patients have, and we will go ahead and get started. Alright, so can you just tell us a little bit about diabetes?
So, diabetes is a condition where the body has abnormally high blood sugars, and we broadly divide it into two, type 1 and type 2 diabetes. In type 1 diabetes, basically the patient's pancreatic cells don't produce insulin because they've been destroyed. It's an autoimmune process, and so these patients are insulin dependent, so they have to take insulin for the rest of their lives. Type 2 diabetes patients have insulin resistance, so their pancreatic cells are still producing insulin, but the insulin can't work, and so the reason for the diabetes is insulin resistance. Type 2 diabetes patients eventually can require insulin, but usually in the beginning we can treat them with oral anti-diabetic agents. There is another type of diabetes that can occur in pregnant women. We call it gestational diabetes, and it's diagnosed in patients during their pregnancy. Usually these patients will have normal blood sugars after the baby is born, and they are at risk for developing type 2 diabetes later in life, so we do tell these patients to watch their sugars closely and follow up with their doctor for screening.
Alright, so now we know a little bit about the different types of diabetes. Some people ask, well, can I cure my diabetes with lifestyle change, or if I change my diet? Is that true?
Yeah, so like I said, type 1 diabetes patients are insulin dependent, so we do encourage them to watch their diet and exercise regularly, but they do need insulin for the rest of their lives. Type 2 diabetes patients, on the other hand, it depends on when we've diagnosed them. So if we've diagnosed them early in the course of the disease and their blood sugars are still not very high, and if they have good pancreatic function, we do encourage lifestyle change so they can watch their diet, eat less carbohydrates and sugars, exercise regularly. And some patients really can reverse the process and either be diabetes free or at least delay the onset of diabetes. Some patients initially at diagnosis have extremely high blood sugars, and so we do have to put them on medicines to help their pancreas initially to get the sugars down. But we do tell these patients to get on, a rigorous exercise program, watch their food, and if they really are compliant patients, they can also reverse the process and either get off medications or significantly decrease their doses of the medications. So yes, it is reversible in type 2 diabetes patients if diagnosed early and if they make significant lifestyle changes.
Okay, well, that's good to know.
Yeah.
All right, so let's say, a patient has diabetes and they're used to taking their regular medications, but then we add insulin. Patients often get confused and think they might be type 1 now.
Right.
So what's going on there?
So when we first diagnose type 2 diabetes patients, we'll start them on a certain drug class of medications, and it may work initially, but in a few months their blood sugars may start trending up. So it doesn't really mean that that drug class isn't working, but it just means their pancreas needs more help, or they need to make more changes in their diet or exercise. So depending on the patient, we add another drug class, and we do this in stepwise manner. We also have drugs now that are not only used to lower blood sugars, but they have other beneficial effects, like they protect your heart and your kidneys. So we like adding these drugs for those benefits also. Eventually, patients may have high blood sugars even though they are doing everything they can and they're on all the drug classes that aren't insulin, and we may have to add insulin eventually. Usually it's once a day basal insulin to start with, but then later we may have to add what we call meal boluses, mealtime insulin. But adding insulin to a type 2 diabetes patient does not mean they've converted to type 1. It just means their pancreas isn't making enough insulin any longer. And one thing I do want to stress is when we add insulin, it doesn't mean that we need to stop all the other medicines, because those medicines are being used for insulin resistance, so they make the patient more insulin sensitive. If we stop those medications, the patient is going to be on very high doses of insulin, and you don't want that because then they start gaining weight, eating more, and then it becomes a vicious cycle. So you do want to continue the insulin sensitizers while you initiate insulin.
Okay, all right. So what's a good blood sugar range or glucose range?
Again, that really is very individualized and tailor-made. So it really depends on every patient. If they are young patients and they are not fall risks, their blood sugar target is usually between 90 and 120 in the morning. If their sugars are consistently higher than 120, then we either want to adjust their diet, check what's going on with the patient, or add new medications if needed. 2 hours after meals, we want it less than 150. In older patients who are fall risks or at risk for having low blood sugars, we don't want to be very strict, so we tell them anything less than 150 in the morning is acceptable, and we do encourage they check their sugars to make sure they're not getting over medicated. In patients who are pregnant, we are very strict because we don't want the baby to have any problems or adverse effects related to the high blood sugars of the mother. So in patients who have predisposing, like who are diagnosed with diabetes before they're pregnant, we want their sugars to be between 80 and the 90s in the morning when they wake up, because in the first 3 months of pregnancy, there's organogenesis where the baby's organs are being formed. So we don't want that to be affected by the high sugars. And then later on in the pregnancy, the baby can grow very large, and we don't want that complication either. So we want the morning sugars to be between 80s, 90s. If it's consistently higher than 100, then we do something about that. We also want their blood sugars 2 hours after meals to be less than 120.
Okay.
So a little stricter when they're pregnant. And surprisingly, most pregnant patients do excellent because they want their baby to be well.
Right. Okay.
So they do really well. They're the most compliant patients I have.
Wow. Okay. And so why is it so important that patients living with diabetes keep their glucose or blood sugar in that target range?
Well, it's really important because you want to avoid complications of diabetes, because high blood sugars affect your blood vessels, it affects your nerves, and the problem is we call it a silent killer for a reason. Patients don't really feel bad with blood sugars in the 200s or 300s, and so patients who don't go to the doctor regularly or have lab work may not even get diagnosed till their sugars are extremely high. So it's important to keep it at target range because we don't want to have complications. When I first see patients, sometimes they are worried about me getting their sugars down to the hundreds because they have symptoms of hypoglycemia, like low blood sugars, even though their sugars are in normal range. But that's because their blood sugars are so high and their body perceives that as normal. But that's not normal for anyone, so I try to tell them that we're going to bring them down gradually to, the target ranges because we want to avoid complications. So 200s and 300s is not normal for anyone.
Okay, good to know. All right, and so are people with diabetes at a higher risk for other health problems?
Yeah, they are at high risk for other health problems, and we are very particular about controlling other parameters when a patient is diabetic to avoid, like I said before, vascular, like blood vessel damage or nerve damage. So we want their blood pressure very well controlled, we want their cholesterol well controlled, because if we don't watch all this, they can have kidney failure and be on dialysis. They can have a sudden heart attack or a stroke. Their nerves can get affected and they can have tingling and numbness in their feet. Some patients have severe pain and then eventually they can't feel to where they can have foot ulcers. And if your blood sugars are really high, it impairs healing. So it's going to impair the healing of ulcers. You can't really have surgeries because it impairs wound healing. So we always want blood sugars well controlled. And then we can also have the nerves of the gut affected. So patients can have something called gastroparesis, where your stomach doesn't empty normally. So we do want blood sugars, blood pressure, and cholesterol well controlled in these patients.
Okay. And what's the biggest tip you would give someone living with diabetes?
I think my most favorite thing is lifestyle change, because that's not just for diabetes patients, it's for everyone. So when I talk to a patient, I want them to take that home to everyone, not just for themselves, because I want their full family to be healthy, and I want their children to be healthy, and I don't want the children to be my patients. So I tell them to watch their diet, watch, you know, carbohydrate intake, sugar intake, and tell them to exercise regularly. And like I said, when they go grocery shopping, I want them to shop healthy foods for the whole family. So that's like lifestyle change, I think, is my favorite thing because it's for everyone.
Right, yeah. That's awesome. I do. I love that answer. Okay. And last question, I know we were talking about lifestyle change, you know, grocery shopping and stuff. How do you feel about low carb diets and intermittent fasting?
Okay, so I do like both those, but the first thing I will say is that I tell patients to always talk to their doctors before they start anything like that, because we do have to adjust their medicines or tell them what to expect. So as far as low carb diets, we are learning more and more that carbohydrates are not really necessary, especially because we are not very active and we don't really get a chance to burn the carbohydrates we eat. It's okay for patients who are athletes or children who are very active, but the rest of us who are sedentary and don't really work out regularly and have an opportunity to burn those carbohydrates, I don't think we should be eating as many carbohydrates as we are. As far as intermittent fasting, again, talk to your doctor before starting that, but I do think it's really great. I think it gives your gut a break. And I think the body really likes that, because otherwise we are constantly exhausting ourselves by eating. We don't realize it, and I know that sounds odd, but the body does like that break, because when you fast for the first few hours, when you stop eating, you're still burning what you ate. Few hours later, around 10 to 15 hours later, you start burning fat. And so I think it really helps the body, and it helps all your parameters. So it not only helps your blood sugars, but you lose weight. It's great for your blood pressure, cholesterol. It's anti-aging, so that's a huge plus point, and it's free. So I think it has benefits all around.
Okay.
So I highly encourage it after talking to your doctor.
Right, yeah. So definitely talk to your doctor before you make any of those major lifestyle changes. Thank you so much, Dr. Chico, for sitting down with us and, you know, answering those really common questions. I know I learned a lot, and I hope you guys learned a lot. If you have any other questions you'd like to ask Dr. Chico, just leave them in the comment section below, and hopefully we can film another video.
Sure.
If you're interested in any more health and wellness videos, be sure to look at our YouTube channel, and thank you for watching.